Dear friends, welcome to Know Thyself YouTube Channel. Good morning. Hope you are all staying safe and keeping well. I sincerely thank all of you who have subscribed to this channel and follow the channel. If you find the contents of the videos uploaded in this channel useful, please subscribe to this channel and click the notification or the bell icon so that you can be notified when a video is uploaded. Kindly share the videos with others or on the internet. In the last 3 episodes of Know Your Mind segment, we considered mental health basics, some common myths and facts about mental illnesses, and the possibility of recovery from mental illnesses. In the upcoming episodes, we will explore different types of mental health problems. In this episode, we begin analyzing anxiety disorders by clarifying the first anxiety disorder, namely the panic disorder. Panic disorder is a rather common mental health problem. It is an anxiety disorder. It consists in experiencing sudden feelings of terror, even though there is no specific reason, no clear danger, or no particular trigger that makes you feel terrorized. When you get a panic attack, you experience bouts of overwhelming fear, a sudden wave of anxiety, a strong feeling of discomfort, and a sense of losing control over yourself. People with panic disorder have frequent and unexpected panic attacks. If a person experiences infrequent and rare episodes of panic attack, it may not develop into a panic disorder. However, if a person had 4 or more panic attacks and possesses the constant fear of having another attack, that person may be suffering from a panic disorder. Panic attacks happen anytime, anywhere, and without any warning. Hence, people who had a panic attack may worry about and live in fear of another panic attack and may avoid places where they have had a panic attack. In some people, fear takes over their lives and they cannot leave their homes. Panic disorder often begins in the late teens or early adulthood, even though in some cases it may begin during early childhood, particularly if these categories of people have experienced stressful situations. Women are more likely than men to develop a panic disorder. An untreated panic disorder can affect the quality of your life, alter the dynamics of your everyday functioning, and lead to difficulties at work or school. However, the good news is that panic disorder is treatable. You can also prevent another panic attack by getting the treatment as soon as possible, by sticking to the treatment plan, and by being physically active. With the right treatment, which includes medication, therapy, or both, most people not only prevent another panic attack but also recover fully. People with panic disorder manifest both psychological symptoms and physical symptoms. Psychological symptoms displayed during a panic attack are feelings of overwhelming anxiety or fear, feeling of being out of control, feeling of going crazy, feeling that one is going to die, feeling of impending doom, an intense worry as to when the next panic attack would happen, fear or avoidance of places where panic attacks have occurred in the past, feeling of being unreal or detached, and feeling mentally worn out after a panic attack. Physical symptoms manifested during a panic attack include faster heartbeat, chest pain, and other symptoms similar to a heart attack or stroke, breathing difficulty or tightness of throat, weakness, dizziness, lightheartedness or faintness, sweating, hot flashes or chills, trembling or shaking, abdominal cramp, nausea, tingly or numb sensation, headache, and feeling physically fatigued after a panic attack. When you have a panic attack, both psychological and physical symptoms can peak within minutes. Though panic attack symptoms are not dangerous and life threatening, since some of the panic attack symptoms resemble symptoms of other serious health problems, such as a heart attack or a stroke, it is important to seek medical help as soon as possible so as to determine the real problem behind the symptoms. Both a medical doctor and a mental health professional need to be involved in diagnosing a case of panic disorder. It is not known what causes panic attacks or panic disorder. However, some factors that contribute to the emergence of panic disorders in people are genetics and family history of panic attacks or panic disorder, personal temperament that is more sensitive to stress or prone to negative emotions, certain biological processes and the way in which several parts of the brain function, major life stress such as death or serious illness of a loved one, a traumatic event such as sexual assault or a serious accident, major changes in life such as a divorce or addition of a baby in the family, smoking or excessive caffeine intake, and history of childhood physical or sexual abuse. Any of these factors or a combination of them can initiate a panic attack and lead to a panic disorder. If left untreated, panic attacks or panic disorder can have significant consequences in every area of your life. Let us briefly mention some of them. Firstly, you may live in a constant state of fear of having another panic attack, thereby ruin the quality of your life. Secondly, you may develop specific phobias such as fear of driving or leaving your home. Thirdly, you may need frequent medical care for health or medical conditions. Fourthly, you may avoid social situations and places where you had panic attacks. Fifthly, you may have problems at work, school, or carrying on with your normal life. Sixthly, you may develop depression, other anxiety, or psychiatric disorders. Seventhly, you may suffer from suicidal thoughts and increased risk of suicide. Eighthly, you may get involved with the misuse of alcohol or other substance. Ninthly, you may be unduly concerned about your finances. Finally, you may become unduly dependent on others to carry on your normal life. You can support yourself or others with panic disorder, firstly by educating yourself about panic attack or disorder. By being aware of the warning signs or symptoms of a panic attack and learning about treatment options, you would be able to identify a case of panic attack and get the treatment needed. Secondly, by communicating with someone you trust. If you are experiencing panic attack symptoms in yourself or others, you need to have an honest conversation with someone you trust, a friend, a family member, or a medical doctor who can help you to get the needed treatment. Thirdly, by knowing when to seek help. If your anxiety or the anxiety of your loved one begins causing problems in your everyday life, such as at school, at work, or with friends and family, it is time to seek professional help. In the next episode, we will talk about the second anxiety disorder, namely phobias. Thank you for watching this video. Stay blessed until we see you again with another video.